Welcome back to Local 5 Live. You know, June is Men's Health Month. And did you know that poor oral health puts men at greater risk for conditions such as heart disease, stroke, pancreatic cancer, and diabetes complications? Well, Howard dentist Dr. Brian Wackwitz joins us now to talk about how men can address this. Good morning to you, Dr. Brian.
Good morning.
All right, let's talk about what should men be alert of in regards to signs of gum disease. What are they looking for when it comes to something of that problem?
Sure. Some of the most observable signs are red, swollen, bleeding gums, chronic bad breath, and loose teeth. In fact, by the time teeth are loose, it's already a pretty advanced stage of the disease.
Wow.
Research also indicates that gum disease in men may impact other health issues. Can we talk about some of these issues that they're at risk for?
Yeah, absolutely. So the bacteria that are in the mouth can get introduced into the bloodstream in the case of gum disease.
Okay.
That'll induce an inflammatory response. And it's that inflammation response and any other diseases that have that as a component that are linked together. So things like heart disease, diabetes, prostate inflammation, and a host of other things we're finding more and more all the time.
So this is important stuff. This isn't something to just kind of say, oh, well, it's not that big a deal. Lots of times I think people don't realize the way the mouth can affect the rest of the body, because this really is, we're all connected top to bottom, right? All right, you know, one of the other things that is worth mentioning too is that medications that some men are taking, whether it's regarding heart or blood pressure medications, maybe antidepressants, can cause dry mouth. Is there some risk in that too?
Yeah, in fact, dry mouth is one of the most difficult things we have to deal with nowadays.
Really?
Yeah. Saliva is very important. It's actually our natural protection from bacteria and from tooth decay. It's twofold. Number one, it provides protection as we eat and washes the food away, the debris, and so that doesn't rest on the teeth. Also, when the mouth is dry, it becomes very acidic. The saliva usually brings the acidity and the pH level up to a neutral level that's safe, but when it's dry and acidic, the bacteria thrive in that environment and are free to produce decay.
Of course, we know that smoking and chewing tobacco puts men at greater risk for a lot of these health issues, but let's really talk about some of the numbers.
Yeah. As far as smoking goes, it's the biggest risk factor, controllable risk factor for gum disease, and it is the key risk factor for oral cancer. 95% of oral cancer cases are men over 40, but we do see it in younger ages at sometimes.
Men are a lot of times athletes too, and I know that another thing we can talk about regarding contact sports, and is there recommendations that you might make for guys that are going to be a little more athletic?
Yeah, a well-fit mouth guard is great. You can get the boil and bite type over the counter, but your dentist can make you one that fits much better. It's going to be more comfortable. It's been shown to prevent, obviously, tooth fractures, but also jaw fractures, and there's even been some evidence that can reduce concussions.
Do you notice the difference between men and women when it comes to how maybe they treat their oral health? Is one better generally than another at keeping up with that?
Yeah, well, I think in general, women tend to be a little bit more proactive and preventative with their health care, and dentistry certainly follows suit. Men are more likely than women to kind of put things off, wait until there's a vent, whether it's a broken tooth,
a problem, yeah.
Crisis.
Exactly, and then react to it.
Okay.
As far as daily habits, women are much more likely to brush their teeth twice a day versus men.
I'll be darned.
So the key here is preventative, is to take the time, take the opportunity to make sure that you're not allowing problems to form by catching something even before it even has a problem with you, right?
Exactly.
Okay, so the preventative option is the best option here. Dr. Wackwitz, we thank you so much for being with us and for giving us some great tips on that too. Now, if you'd like more information, you can subscribe to a quarterly newsletter called Tongue in Cheek and Tooth Too on WDA.org, or head to the website. You can look under oral health. Finally, there are good resources on mouthhealthy.org as well. Again, Dr. Brian, we thank you for your time today.
Thanks for being here.
Thank you. Appreciate it.